Autism, the 100 pieces of the puzzle to help understand what you can do. Autism is affecting 1 in 100 people or more in certain parts of the world. And this, for me, is something that's important to help people learn about and to understand what they can do. So this is going to be a series of videos called the 100 pieces of the puzzle. So the whole idea is for you to find the pieces that you can put into place and find something else to put into place that's going to help you. There's no guaranteed result from using one thing. It's a matter of finding all of those different pieces and find what works for you. So these series of videos are going to be for you to give you ideas on what you can do. So a brief introduction about myself. My name's Dimitri. I focus on creating relaxation videos on my main channel, which you can look in the description to get a link to it. And over the last year or two, I've become involved with people in the autism community. And so I've developed quite a passion to help people. And I help people with my other YouTube channel. And so I wanted to try to see if I can create an information tool for people to help with ideas on what you can do. So this video is mainly going to be focused on the early signs of symptoms. It's so critical that you do what's referred to as early intervention. Early intervention is when you realize that there is a developmental problem with the child and you can act immediately to help in any way that you can by finding those pieces of the puzzle that's going to fit for you or your situation to give you the best outcome. So these are certain terms that I'll use over these videos. So early intervention is critical to the development of that child, and we'll refer to as the best outcomes as what you can do to give that child the best outcome possible, to remove all of the limitations that that child may have to develop like a normal child. So autism works in a way where it kind of blocks neural pathways and limits development. So what we want to do is realize that there's a problem. That's the first thing. And don't get too sad over the situation. You need to basically look at your situation at hand and find a way to move forward and progress. And so I'm hoping that I can give you some ideas to do that. Early signs of autism. Okay. So research, I'll see if I can find the video, but I'll put a link down below, look for it, on actually asking the child's name and seeing if the child responds to being called by their name. This is one of the earliest signs that you can use. And you can't use this under 18 months of age, but it's something that you can use just to make yourself aware of the potential. So no diagnosis can happen before 18 months in most situations. And normally about 2 years of age is when it's done. So if you call a child's name and very rarely do they look and respond to being called, that is a sign of concern. And that's an important thing for you to realize. So I'm going to go through a little list that I just pulled off the internet, which is a very basic list that gives you some ideas. So this is for friends and family and people. Please, I plead with all the people that watch this video. If you suspect a family member's child or a friend's child has a developmental issue, please do not say nothing. You must say something. This is just as critical as realizing there's a problem. Is if you realize there's a problem in someone else's child, please say something. please say something, okay? Your silence can harm that child, where your voice can help in a huge way. Early intervention is critical, okay? Some of the signs. So the first sign is doesn't respond to when their name is called. Lack of eye contact is another big sign. If you look at them and they kind of look away, that's an important sign. Whereas with a normal developing child or a neurotypical, that they will give you good eye contact and they'll smile and things like that. So when you smile at the child, if they smile back, that's a kind of normal action. But if they don't smile back, that's a sign. They don't really follow objects that much. They don't point or wave goodbye or hi. So they're not using gestures to communicate. They don't make noises to get your attention. That's another sign. They don't really initiate or respond to hugs or cuddles. And they don't imitate movements or facial expressions. They don't reach out to be picked up. They don't play with other people, and they don't ask for help or a basic thing like water. They kind of expect you to know when they need something. So some of those terms that we just went over is neurotypical. A neurotypical is a normal developing person, and that they, like most of the percentage of the population, they're a normal neurotypical, whereas someone with ASD or autism, their way of thinking is different. It's not wrong. It's not bad. It's just different. And I have a few basic beliefs on this, but we'll get into that another video way down the track. So there's nothing wrong with them. Nothing at all. But they just think differently. An example might be Bill Gates. People might think Bill Gates is what's referred to as an ASD, which is a different form of autism or ASD. So Albert Einstein was possibly a autistic person. Okay, so they're not, some of these people can be extremely clever, and their way of thinking is different. It's different. So I might be considered neurotypical. So neurotypical is a term that I'll use. Early intervention is a term that I will use very often. Imitation. Imitation is a critical key for developmental learning, and it's a weakness in kids with autism or ASD. And just think about it, when you go to a new job and you need to learn something, someone has to show you. So you're imitating the actions or the series of events that someone has taught you. So you're imitating what someone taught you. And that is something that will go through from a child to school to high school, all the way through your life. You will use imitation to learn. So imitation is a critical key for development for these kids. So this is just a quick basic video to try and help you with some of the signs to see if the child has a developmental issue. If they're not hitting milestones. So doesn't respond to their name being called. Very poor eye contact. Doesn't smile when they're smiled at. Doesn't follow objects. Doesn't point or wave goodbye. Doesn't use gestures to communicate. Doesn't make noises to communicate. Doesn't play with other people. Doesn't ask for help. Doesn't imitate movements. These are very broad, common things that autistic or kids with ASD will have issues with, and it's a very early sign. Things is like lining things up, rocking backwards and forwards, flicking light switches, stacking things. These are all things that ASD kids will do. But there is quite a number of things that you can do. And again, it's about finding those pieces of the puzzle that's going to fit for you. So welcome to the 100 pieces of the puzzle to help with autism. And I really hope that I can help. If I can only help one person in the world with these videos, then it was worth it. Thanks.